What is up, YouTube fam, active duty and vets? Y'all know what it is. And let's talk about how you can get anxiety service connected, either on a direct or on a secondary basis. Tune in. Let's get into it. First is going to be direct service. Hey, if you got in-service complaints, a diagnosis, treatment, you can always seek that route. If not, if it's something that you was diagnosed after the military or something that you're looking to get diagnosed, hey, you can always do secondary claims, which is always good. You don't need to try to build a bridge all the way back to your military service. You just need to build the bridge from your already service-connected disability. And some examples of that, you can use tinnitus, sleep apnea, lumbosacral strain, cervical strain, feet issues. There's a lot of things you can secondary mental health claims, mainly in anxiety. That's what we're talking about, too. So don't get hooked up on, oh, I need to build the bridge back, back to your active duty time. I need to go out buy this Nexus letter. It's going to cost $1,500 more. No, you don't need all that. In some cases, yes, you may need a Nexus letter to build that bridge back to your active duty time. However, with anxiety and mental health claims, you don't necessarily need that because you can start off with, just build it from a secondary. Let's get into the percentages you can get for anxiety and what they look like. Somebody hit that slide deck. All right, so for the 0%, it's going to look like, okay, you got a diagnosis, you have some complaints, but your issues aren't severe enough to warrant anything higher than a 0%. But we are going to service connect you, and we are going to get you, some benefits, get you treated at the medical. Now, going into 10% criteria, now you're starting to report, hey, I have issues in my occupational as well as my social life. They're just mild. It's not everyday thing. It's a once in a while. It's an occasional thing that you're experiencing anxiety. Hey, you have some slight work issues. You can't really, perform tasks to your fullest ability, but, you're still doing it. It may take a little bit more time to do it, but you're still going through it. Getting into the 30% criteria is you have increased issues in your work and your personal life, and it's starting to decrease your work ethic as well as your interpersonal skills with other people. You can't perform as good as you were. Now your routine work life and your everything is starting to slip. Your behavior, your self-care, you're not conversating with people normally. Now you're expressing depressive mood, anxiety, suspiciousness to people around you and things, panic attacks. They may be happening, once a week or less often. Now you're starting to have sleep impairment, maybe sleep apnea, restless leg syndrome, insomnia, memory loss. You're starting to forget names, recent events. This is when you're always whipping out, hey, I gotta look at my notes to see who this is, or you're saving people as a Franco the dog person. You know what I mean? Or you're saving, hey, I know what it is. Getting into the 50% criteria, it's almost the same thing. The only thing you really need to do is record your symptoms. Complain to your doctor. More than likely, they're gonna start writing some of the symptomology down in their notes. You're having panic attacks more often now. Difficult understanding complex commands at work. Impairment to your short and long-term memory now. Now you're only retaining highly learned material, pretty much like things that you do on a regular basis, not so much things that you do in the passing or on an optional basis. Impaired judgment as well as abstract thinking. Disturbances in your motivation and your mood. Hey, if you used to be that guy running 5Ks and 20Ks, now you ain't. Hey, document it down. Get it. Complain to your doctor as well as start building your personal statement. Now, let's get into the 70% criteria, which is pretty much your work is going to shit. Now you're starting to talk about suicidation. You have obsessive rituals, speech impediments, or you're talking about things that are irrelevant at the time during that conversation that you're having with somebody. As well as, near constant panic or depressive attacks and stuff like that. You're neglecting your appearance. You're not getting haircuts anymore. You don't care what you wear. You're smelling like booty. And we don't want to smell like booty going out here. If you're a female or a male vet, hey, clean yourself up, get yourself taken care of, complain about it. Hey, if you fit this criteria, go in to your doctor and let them smell you. And I'm going to say, oh, hey, vet X, you smell like booty right now. I'm like, yeah, I know, my life, everything has been going going to shit. So you want to make sure that you take care of this. Go complain to your doctor and get the benefits. Lastly, at 100%, we got gross impairment of thought. Or now you're doing things that you know you shouldn't be doing, but you're doing them anyway. As well as you're disorientated with time. You don't know, can't remember stuff, can't remember your relatives, don't even know where you work and what you do half the time. You're always hurting yourself or others, and you just can't perform daily activities on a normal basis. And at this point, this is when the VA, they'll say, okay, this vet needs help. You need to get him at the 100% and possibly induct him in like an inpatient or somewhere like that. But, don't sell your symptoms short, as well as don't exaggerate, because the VA, they are going to do some due diligence, especially if you're trying to get 100% for a mental health disability. It's not impossible, but just know it's going to come with a cost. Hey, if y'all like this type of content, y'all know what to do. I ain't got to tell y'all no more. I mean, I still got to, because these... Hey, y'all know what to do. Till next time, the D-Boy.